Hello, my name is Suzanne Smith, and today I'm presenting our research on Daycare at Home, which is an online community daycare program for older adults. Firstly, I'll give you a little background on the project, and then I'll talk about the methods we're using, our findings to date, and finally a quick overview of where we're going next. We know that there are strong links between social ties, mental health and resilience in older people. While community daycare is an area that has received very little attention in the research, we do have some evidence that participation in community daycare is linked with positive mental health and it increases quality of life for older adults who participate. The COVID pandemic cut off access to this valuable resource for many older people. At the same time, we were seeing a push for us to turn to digital technologies to ensure that older people were not forgotten or excluded and to make sure that they remained socially connected. A community daycare centre in Drogheda, a town in the northeast of Ireland, decided to use technology to stay in touch with daycare members by delivering activities online. And they also saw this as an opportunity to test this solution, which they call Daycare at Home, for possible sustained use post-pandemic. When we got involved in the project back in September 2020, the daycare service had just started delivering an activity, either gardening or mindfulness, once a week using Zoom, and they had about 3 participants involved at that stage. So there were a number of key questions they wanted us to explore. One of them was whether or not the online daycare format would actually work, whether delivering the activities in this way would work, and whether daycare members would actually participate in this type of service delivery. The other question was, would staff and volunteers be actually able to deliver it from a technical skills point of view? And then would it solve concerns or issues they have around waiting lists for daycare services? So those were the key questions we were looking at. We started from the position that after the pandemic, there'll be a need for strong community resilience. Therefore, we need to consider the experiences of all stakeholders within the daycare community system, if you like. We also know as living labbers that for community-based solutions to be sustainable, multi-stakeholder partnerships are absolutely essential. So this project involves all of these stakeholders in various ways, as you'll see. A research advisory committee was set up, including the members of the daycare, family members and daycare service facilitators. The daycare then conducted a survey to see if members were open to participating in an online service delivery and found that 69% were willing to engage if they were supported to do so. Unsurprisingly, lack of technology was a barrier for most. So next we explored the technology and devices that were needed to make this work. Once devices were identified, then distribution began, but this proved to be less straightforward than expected. At the same time, other community stakeholders we work with on other projects were coming to us for help with how to get older people in the community onto tablets and computers to keep them connected during COVID-19. So this led us to setting up a workshop series we called Building Digital Bridges with a range of community stakeholders so that everyone could work together to identify challenges they were experiencing and share solutions. So the need for training and resources was identified out of these workshops. We then received some funding from Dundalk Institute of Technology and Dublin City University for a summer undergraduate research programme, which saw us bring a multidisciplinary group of students together to work as part of the Living Lab team to develop resources and help us to tease out challenges with the daycare service. So some resources are currently being developed or finalised at the moment. And then in addition to that, we have stakeholder interviews, focus groups with family members and with team members and volunteers and so on. And that is being wrapped up at the moment and the data is being pulled together for analysis. To give you some perspective on where we are now, back in September of last year, we had a service that was running one afternoon a week with maybe 3 or 4 participants. And now 12 months later, there's a wide range of activities being offered 4 days a week, sometimes twice a day, with more than 10 people active in each activity at each time. So that's a significant increase in participation over the past 12 months. To quickly run through our findings to date, let's start with the service users. The service users we talked to found that they were surprised by how much fun it was to engage with Daycare at Home and how normal the interactions and the chat and the banter was. This whole issue around how normal it was and how surprised people were about this largely actually came from people who were only engaging with Daycare at Home and who hadn't engaged with the Daycare face-to-face service because they saw this service as being for old people. They themselves were in their 80s, but they didn't see themselves as old. So what was interesting about this was they also said that actually as a result of their Daycare at Home interaction and engagement, they would be encouraged to now begin to engage and attend the face-to-face daycare activities. So that was an interesting finding that we will be exploring more in the data. Service facilitators identified that their own digital skills literacy, as well as the digital skills of service users, was a challenge, and that facilitating people to engage in the Daycare at Home took extra time, and that was a challenge that we've been trying to work on throughout the project. However, overwhelmingly they expressed pleasure in seeing how much fun the Daycare members were getting from their experience with Daycare at Home. Likewise, family members identified that sometimes supporting their family member to participate in Daycare at Home was either time-consuming or inconvenient, or both. They expressed some concerns about their own digital literacy and how that posed some challenges for them in helping their family member. But again, there was a theme that arose among family members about how their older family member was enjoying the participation in the Daycare at Home services so much and having so much fun. So those were some initial themes that were arising from the data. Based on the themes that we've already seen in terms of digital skills, we're now evaluating the digital skills of the staff and volunteers in the day centre, and we'll be evaluating the impact of digital skills training on them. In terms of the other themes, we have a workshop which we're hosting on Thursday. We invite you all to come along. And we will be looking in that workshop to get the experience and perspectives of living labbers to give us, I suppose, a bit of a steer or direction and feedback on what might a sustainable Daycare at Home model look like. Apart from that, we're continuing to do data analysis and disseminating our findings with the hopes of increasing engagement, not only within the daycare service, but also the wider community, and ultimately, I suppose, to seeking funding to sustain Daycare at Home. Thank you very much for your attention. If you would like to find out about this project or any of our other projects, you can find us at netwellcasala.org, or please feel free to email me directly at suzanne.smith@dkit.ie. Enjoy the rest of your day. Thank you.